The risks of obesity, it's 100 times more than the risk of medicines.
Like when it comes to weight loss, it's seen as more aesthetic.
BMI is 35, 40, very high blood glucose, blood pressure, osteoarthritis, obstructive sleep apnea, fatty liver. They have all the complications, but they are only scared of one thing: I will have side effects.
In our country, they link building muscle to having a masculine aesthetic.
Everything is protein today, protein water, protein makhana.
Yeah.
क्यों है हमारा visceral fat इतना high? Why is this so prevalent in Indians specifically?
The thin fat phenotype that the Indians have. So this fat is the the dangerous kind of fat that is going to lead to all the metabolic complications. We might look healthy, we might look thin, but we really are not.
Hi, my name is Saloni Paliwal, and I am the co-founder of Earlyfit, a tech-led holistic weight loss platform backed by India's leading endocrinology doctors. Today, in a special collaboration with Novo Nordisk for World Obesity Day, on the war cry of choose your weight, I am sitting down with two of India's top endocrinologists, Dr. Saptarshi Bhattacharya and Dr. Simran Thakkar. Today, we're going to talk about obesity, how losing weight can often feel impossible, and why diets, workouts, and lifestyle alone are not effective for many. If you're dealing with obesity, you're not alone, and there are solutions that can help. Tune in for the full episode on our YouTube. Dr. Saptarshi, Dr. Simran, we are so excited to have you today, and we'd love for you to start with an introduction.
Hi, my name is Dr. Simran Thakkar. I've done my MD medicine from Mumbai and I've done my super specialization in endocrinology from Indraprastha Apollo, Delhi.
I am Dr. Saptarshi Bhattacharya. I am practicing as a senior consultant in endocrinology in Indraprastha Apollo Hospitals, New Delhi.
Amazing. So basically, you guys are the experts in everything metabolism, obesity, and weight loss. So I'm very excited to dive into some of these topics with you today. Let's start with the basics. What exactly is obesity, and how is it different from looking fat or being overweight?
Obesity, first of all, we have to understand it's a chronic disease. And on top of that, it's a chronic relapsing metabolic disorder. And so what do we call as a disease? Disease is a condition which can cause problems now or it can cause problems later. It's high time that we recognize it as a chronic disease and we treat it as a chronic disease. If you stumble, then meet the right doctor so that he can help you out of this.
Nice. So how do you tell though? How do you tell if somebody is obese, whether they're just overweight or obese or fat on the outside or inside? How do you tell these differences?
So it's not just about how you look, it's not just about your weight. We calculate the body mass index, we see the waist circumference. There are certain markers of insulin resistance and metabolic dysfunction. We can see the body fat percentage. So all these help us diagnose obesity per se.
And why is this such a big problem? Why is this something that needs to be treated now and immediately?
I think one reason is that so it has always been there, but obviously our lifestyle has changed and the numbers are like really going up. So if you look into Indian numbers, it's like close to 258 million. So almost from 15 to 20% of Indian population will be actually obese. And actually, if you look into abdominal obesity, which is even a stronger marker of future metabolic conditions and diabetes and heart disease and all these metabolic risks, the risk with abdominal obesity is even higher. And Indians and Asians, they have a unique body structure where they might be apparently not looking obese, but they have a lot of fat around their belly. Even if you don't always satisfy the criteria for BMI, but if your waist circumference is more, you still carry quite a large number of risks that is associated with obesity.
250 million, that's wild. What are the other reasons? Like, I understand like having abdominal fat. Why is it bad? Like, what's the worst that can happen? Why is it so important to treat obesity today?
So like Dr. Bhattacharya said, that it's like the thin fat phenotype that the Indians have. So this fat is the the dangerous kind of fat that is going to lead to all the metabolic complications that we see. Be it your liver, be it your ovaries, be it your heart. It's going to affect every organ of your body ultimately.
Some amount of fat is good for your health, but whenever it reaches a certain limit, certain threshold, then it starts spilling over to all the organs.
And what is that threshold?
So usually that will correlate with a BMI of 23. Above 23 we call overweight. Above 25 in an Indian context will be like obese. So whenever somebody is even going above 23, there is evidence data from Indian and Asian population that this fat starts spilling over to liver, and then we call it fatty liver. It then, if it spills over to pancreas, then chance of developing diabetes increases. It can spill over to the area around the heart. Then the chance of cardiac disease increases. So there are clear cut markers, clear cut indices where fat can actually lead to complications which we see and keep on discussing so often.
Yeah. And often, like, somebody can be obese, but at the same time, they could be feeling fine. They could be very active. They could be working out and eating healthy. And all their blood tests are coming out normal. So, in that case, is it okay to stay obese or overweight?
So it's very common. So somebody is having diabetes and he's telling, okay, my blood sugar is 250, मेरे को दवा क्यों लेना है? I am totally okay. But whenever we are treating somebody, say with diabetes, or somebody is having a blood pressure of say 150 by 100 and is not having any symptoms, so we started the conversation with that there can be acute complications and there can be chronic long-term complications which you do not have today. But if you have a medical problem, you are not addressing that, future में जाके वो
So,
problem
you
तो
might be
करेगा.
feeling fine
So you
today,
might be
but you may not continue
absolutely.
to.
So what, as doctors and endocrinologists, what we want you to do and what we also want for all of our patients and overall for the society is that people should be staying healthy on a long term. So for that you need to reach certain benchmarks. Okay, you, if your blood pressure is below 130 by 80, so you are protected against a lot of complications. If your blood sugar is below a certain level, you are protected against a lot of complications. Similarly, if your cholesterol level is less than a certain amount, so then also it offers protection against cardiac problems. That will improve. So it's necessary because we want you to stay happy and healthy today, but we also want you to stay healthy and happy in the future as well. We are really worried that somebody is coming and telling, okay, my weight is BMI is only 27, so why do I need to get myself treated? I am perfectly healthy. I don't have any problem. I am exercising. I am eating the right thing. I am doing all the right things. But still, why is there a cause for concern? So because the future complications are actually
And
correlated.
can you list them out, all the future complications?
There are innumerable complications, be it fatty liver, be it PCOS, be it cardiovascular diseases, stroke, arthritis, obstructive sleep apnea.
And even some of the
Wow.
cancers actually go up. So the breast cancer go up.
So you're saying you're still at risk for all of these things, even if you're feeling fine today, but there's a higher chance you'll
Definitely,
develop these in the
definitely.
future.
Because it's a silent disease, so it's going to do damage in the background.
So if you could recommend one lifestyle change for weight loss, what would that be?
I think it's important to have an exercise regularity. That is something which we are really lacking. There are people who are going to gym regularly. There are people who are going for their morning walks. So majority of them actually are not. The physical activity part is really lacking. So you need to have a structured exercise routine for yourself. It can be like cardio, ideally combined with muscle strength training, some stretching also. If you're doing your cardio, make sure it's not a very casual one. It's not a light stroll. That it should increase your heart rate and you are actually sweating out. Similarly, you need to have the proper guidance and start building up your muscles. You will require some amount of strength training. It has been shown it has multiple benefits in terms of insulin resistance and your overall glucose sensitivity, and all those things do go up whenever you start doing it.
I absolutely agree with you. And there's one more thing I'd like to add is adequate protein intake. Protein is a must.
Yeah, we do hear about this. Like, everything is protein today. You know, protein water, protein makhana. Why is protein and muscle like suddenly so important?
What we see is that muscle is important and the proteins are the building block of muscle. So if you are depending on excess of say carbs or excess of fat, so excess of carbs if you're taking, that will again equivalent to extra calorie and that will actually get deposited as fat. If you're taking extra fat, or that way, that will straight away get deposited as fat. So if you want to build up your muscles, if you want to improve your metabolism, you need to take protein. And muscle is like a glucose sink. If you are eating carbs or eating your food, it's getting digested in your gut, then it's reaching your bloodstream. With the help of insulin, muscle is the one which actually takes up all the glucose from your blood, and it acts as a sink for the glucose. It gives you protection against blood glucose spikes and all. So if your muscle mass is good, so that gives you a better insulin sensitivity, and your glucose spikes are going to come down.
And unfortunately, I think in our country, they link building muscle to equivalent to having a masculine aesthetic. However, it is not so, because this muscle strength training is ultimately going to combat the insulin resistance. So definitely strength training is very, very important, and adequate protein intake is a must as well.
So when we're talking about proteins, and like there's also a lot of conversations around the GLP-1 and GIP hormones. So how are you seeing that being linked to obesity, and like are people deficient in GLP-1? Like what's the conversation about?
We have been using GLP-1 for almost more than 2 decades, and GIP GLP combination has come up over the last 5 years or so. These are actually very, very effective hormones which can regulate your appetite, improve your insulin secretion, counter some of the hormones which are like anti-insulin, and they cause blood glucose spikes. And also they change the motility of your gut, slow down the gut movement, so the glucose spike is also less. So these are hormones which we see that in diabetes and even in obesity, their actions are slightly deficient. If you're taking these hormones from outside, it's going to counter that deficiency. So this hormone is a signal which is going to tell your brain, okay, it's enough, you need to stop now.
And do our bodies start producing lesser GLP-1 over time? Or like why are some of us deficient or need a medication to mimic the effect of these hormones?
So it has been clearly shown in diabetes and pre-diabetes that the GLP-1 action actually starts to go down. So whenever you are eating your food, so the food reaches the gut causes these hormones to enter the bloodstream. They then act on the pancreas, they then act on the liver, act on your brain. That response is definitely lower in diabetes, in pre-diabetes, and also partly in obesity.
Often people see diets and workouts as natural ways to lose weight, and then obviously the medical interventions are seen as unnatural or last resort. So how do you help your patients reconcile the two when they're on a weight loss journey?
I think it's a mindset. So first of all, we discuss it's a chronic disease. It has multiple long-term complications, and what we see is that if you lose a certain percentage of weight, that complications do come down. If somebody has been diagnosed with diabetes in say in initial 1-2 years or so, and his weight is maybe BMI is say 35 or so, and if he loses 10-15% of his weight, actually the diabetes sometimes goes into remission. Similarly, if somebody has fatty liver, so if they lose around 10-15% of weight, that actually settles down. So there are definite targets for weight loss, and weight loss naturally and ideally should be done with diet and exercise, but it has important limitations. So they should be, if you are taking a medication, it's not that you should be stopping dieting and exercising, you still need to do it. But even if you combine diet and exercise and you do everything, the maximum weight loss that is usually seen is 5%, sometimes 10%. In very intense cases, it can be 15%. But again, the challenge remains that if you're not able to sustain it or maintain that intensity of exercise and dieting, whenever you stop doing it, it comes back. The weight will come back definitely.
And moreover, I feel is diabetes and hypertension are life-threatening disorders just like obesity. If we are not hesitating in taking treatment for those, why are we hesitating in taking treatment for obesity?
Yeah, I mean, people take insulin and BP
Absolutely.
medications all the time, but like when it comes to weight loss, it's seen as more aesthetic.
Like BMI, if it goes above 30-35, that decreases lifespan by almost 5 years. So there's clear cut
Wow.
evidence behind that. If you are treating obesity, you are actually increasing your life.
What do you say to somebody who's refusing to try anything other than diets and exercise? How do you make them see this picture?
We need to respect their belief, their perception, and we do encourage them to do it naturally. What we also at the same time do is set them targets. If we see a person is having this amount of BMI and is having this problems, we have a discussion that okay, this is your current BMI, your weight is causing all these problems. If your BMI comes down, so if somebody is having osteoarthritis, that gets better. If somebody is having obstructive sleep apnea, that gets better. Some ladies having difficulty in conceiving because of PCOS, that also gets better with weight loss. We try to set them targets. This is your target. If you reach, these are the benefits you are going to get. If you are able to do it naturally, it's good. If you are not able to do it naturally, then there's no harms. As Simran said, that if you're not scared to get treated for diabetes or blood pressure, cholesterol, obesity is a very, very similar condition. So why are you getting scared to get treated for obesity?
And what percentage of people are actually able to lose weight, that amount of weight, with diets and workouts?
Very less.
Very less.
So if you see in most of the recent obesity trials, the weight loss percentage in almost more than 50%. Half of these people, the average weight loss is like 15 to 20%. If any diet program and any exercise program or a combined program with best of resources, best of dietary plans, best of exercise facilities, it hardly goes, the average weight loss will hardly go beyond 5-10%. It has never been seen before, other than maybe through bariatric surgery. That was one, but that is like an invasive procedure. So with medicines, I don't think none of the medications till date have reached that amount of weight loss.
So, what are the solutions available today for obesity, and how much weight loss can people expect with them?
So it can range from liraglutide, semaglutide, and the current dual analog, that is GLP plus GIP, that is tirzepatide. So we can expect around 15% of weight loss with semaglutide and around 15 to 20% of weight loss with tirzepatide. And then comes the surgery, the invasive procedures like bariatric surgery, intragastric balloon surgeries.
Honestly, I've heard this a lot, that GLP-1s are a shortcut, that medical intervention is a shortcut, or do it the right way. What are your thoughts on that?
So let me give you an example. So if somebody has fever because of some infection, even the body is supposed to take care of the infection naturally. The body has its own immunity, right? You do take antibiotics and you get recover earlier that way. And so the same thing is valid for a condition like weight, because you can do it on your own, but it's really going to be hard on you. So you have medications which are proven to be safe, effective. They have been studied in millions of people. And on top of that, millions of people have used it also all over the globe. I don't think it's a shortcut, it's a treatment.
Medical interventions for weight loss, they carry some risks, some side effects. How do you help patients evaluate those?
So there is a dictum in medical world that you need to balance the risks and benefits. Traveling in a flight, that also has a risk. So you need to balance. If you stay with that condition, what are going to be the long term risks versus if you take a particular intervention like an injection or a medicine, what are going to be the long term risks? And there is no confusion that the risks of obesity, it's much more, it's 100 times more than that, than the risk of medicines. The risk of medicines are predictable. We know what are the side effects. You need to take the right guidance from the right doctor, and you can actually overcome most of the risk.
Yeah, for sure, for sure. And then why is having a doctor, a coach, and all these things so important? Like, we just saw people just buying from the pharmacy, no prescription, nothing. Why is it so important to have guidance and supervision when dealing with weight loss medications?
So first of all, it should be, we have to decide whether it is a right candidate who is receiving the medicine. So that screening will be done by a correct doctor, right doctor.
So this is a prescription drug, so they carry the risk and it requires monitoring. So you really need to meet the doctor, get tested, get the test done. Lab tests might be required before starting the medication. There are routine tests which should be done in person who have access to it. And then if the doctor feels that you are a candidate, then he will offer you that treatment. That is, and also will monitor for side effects and also will monitor for the benefits. That is the way to go about it.
Both obesity and its treatment are very misunderstood. So, do people come to you with a lot of misconceptions, myths around it, and this? What are some of the common ones?
Actually, there are a lot of misconceptions regarding this. One of the most common one that I hear in my OPD is that if I lose weight with this GLP analog, I'm going to lose my glow. Or even they think that once they are on this medicine, they do not need to put an effort from their end. So, for example, they think that I don't need to diet, I can eat anything, or I don't need to exercise because I am on this medicine.
One challenge I do face, the BMI is like 35, 40, very high blood glucose, uncontrolled blood pressure, osteoarthritis, obstructive sleep apnea, fatty liver. They have all the complications, but they're only scared of one thing. Nee, I will have side effects. As if all these are not side effects you're already having because of obesity. So that mindset has to change.
Coming back to the 250 million obese Indians, how did we get here? What is driving this? And often we see multiple members of the same family being obese also. So is it genetic? Is it something else? What's going on?
It is genetics. I mean, genetics plays a very big role in obesity per se. But it's just not that. Because if a husband and wife are coming who are belonging to the same family, it's not genetics, they're not related. So lifestyle also matters a lot. The diet, the sedentary lifestyles all play together a role along with genetics. Moreover, in our country, in our setup, the Asians per se, they have something called as a thin fat phenotype. So it's like thin outside but fat inside. The visceral fat, which is the bad kind, which is driving all the metabolic complications that we just talked about. So, overall, we might look healthy, we might look thin, but we really are not. So, yeah.
Why? क्यों है हमारा visceral fat इतना high? Why do we have abdominal fat? And why is this so prevalent in Indians specifically?
There is called the thrifty gene phenotype. So that is one concept that we have gone through lots of famines and our genes. So there are
It's evolved
something
that
called
way.
epigenetics also. There obviously genes are something which is more stable there, but again there can be more modifications around the genes, and that can be environmental also because of long-term scarcity and famine. So we have been programmed in a way so that we tend to preserve fat to retain our stores of energy, and that is actually fat.
Wow. Yeah, I mean, so many life threatening conditions just coming from this one issue, which again is treated as an aesthetic issue still. And can you talk a little bit more about just the cost? I feel people often talk about the cost of weight loss treatments, but at the same time, we're spending so much on surgeries, and the cost of reactive healthcare is really, really high as well. Like, how do you talk them through the cost angle?
Maybe if you are going for a movie and you end up paying almost just $1,000 for a bucket of popcorn, which would have otherwise been like 10-20 bucks. You are happily doing it, and you are also putting yourself at risk. So you're eating all the junks at the same time. So if you are actually thinking about long term, the cost of cardiac disease, cost of osteoarthritis, the cost of a knee replacement, the cost of a stent, or the cost of a liver transplant, maybe the cost of cancer treatment. So the cost of all those, and these are all complications. So you won't tend to correlate one to one. What we see is अच्छा जो साथ 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 हो रहा है हमें वही दिखता है, जो लॉन्ग फ्यूचर में जो हो रहा है वो हमें नहीं दिखता. So if you just look into the future, so the amount of cost, it's nothing compared to what the cost of the medication is, and top of that, nothing is more important than your life. These are obesity actually decreases your lifespan. It's high time we understand that.
Okay, so to close this out, what's one piece of advice you have for somebody who's considering pharmacotherapies for weight loss?
I think it's important to combine it with lifestyle. So it's alone, this is not going to be sustainable. So this is an effective medicine, this is a safe medicine. But again, you need to change yourself at the same time. We are not judging people who are struggling to lose weight because that's not really their problem. It's their metabolism, it's their genetics. Maybe to some extent, some minor changes will help. So if you are more mindful about what you are eating, maybe one good habit can be checking the food label. So many things we apparently think, okay, this is healthy, this has been promoted as a diabetic food supplement, but if you look into the food labels, you see that this has this amount of natural sugar, this amount of saturated fat. You need to read it for yourself, try to understand what is good for you. Do exercise, and if you are actually planning to go on a GLP-1, do it under the right guidance, do it safely, do it effectively. I think that's going to make a lot of difference. We have people who actually come back and who tell that we are feeling good about us.
That must feel very rewarding.
Absolutely. And one more thing I'd like to add is along with the lifestyle modifications, you definitely need to do strength training and have a good amount of protein intake. And do not need to blame yourself for your obesity. It's because not of your lack of motivation, it's just because it's a metabolic health condition.
All right, that was incredible. Thank you so much, Dr. Simran and Dr. Saptarshi, for joining me today and for your incredible insights on obesity and its management. This World Obesity Day, the message is that you do not have to fight your biology alone. Understanding that obesity is a disease gives you the power to control your health. When you align the right medical support with the right lifestyle, you finally get to choose your weight. If you or someone you know is struggling with obesity, you're not alone and there is no hesitation in seeking help. Log on to www.novocare.in, like, share, and subscribe to our channel for more expert led content around obesity care, and drop your comments and questions in the chat. Thank you so much.